deadly outbreak of the Nipah virus in India's West Bengal state has triggered heightened concern across Asia. With the virus's high fatality rate and lack of treatment options, neighboring countries are taking swift action. Thailand and Nepal have begun screening passengers arriving from India, especially those from West Bengal, at major airports and border crossings. The rapid response highlights the seriousness of the situation and the interconnectedness of public health in the region. As news spreads, authorities are working to prevent the virus from crossing borders and causing wider outbreaks. The Nipah virus is a zoonotic pathogen, meaning it can spread from animals to humans. First identified in the late 1990s, it has since been recognized as a major public health threat. The virus is carried by animals such as pigs and fruit bats, but it can also spread between people, especially through contaminated food or close contact. The World Health Organization lists Nipah among its top 10 priority diseases due to its epidemic potential and the absence of effective treatments or vaccines. Understanding what Nipah is helps us grasp why authorities are so vigilant. Nipah virus transmission is complex and concerning. It can jump from animals, like pigs and fruit bats, to humans, often through direct contact or by consuming contaminated food. But that's not all. The virus can also spread from person to person, particularly in healthcare settings or among close contacts. This dual mode of transmission makes outbreaks harder to control and increases the risk of rapid spread, especially in densely populated areas. That's why monitoring and early detection are so crucial in containing the virus before it moves beyond its initial cluster. Symptoms of Nipah virus infection can vary widely. Some people may not show any symptoms at all, while others experience fever, headaches, muscle pain, vomiting, and sore throat. In more severe cases, symptoms can progress to drowsiness, confusion, pneumonia, and even encephalitis, which is a dangerous inflammation of the brain. The incubation period ranges from 4 to 14 days, making it challenging to detect early. With a fatality rate between 40% and 75%, the risks are significant, especially since there are no approved drugs or vaccines for treatment. The first recognized Nipah outbreak occurred in Malaysia in 1998, primarily affecting pig farmers. The virus quickly spread to neighboring Singapore, leading to over 100 deaths and the culling of 1 million pigs. The economic and emotional toll was immense for those involved in livestock farming. Since then, Bangladesh has faced repeated outbreaks, with more than 100 deaths since 2001. India has also experienced several outbreaks, notably in West Bengal and Kerala, with high fatality rates. These historical events underline the virus's capacity to cause both human tragedy and economic disruption. Recently, 2 cases of Nipah virus were confirmed in West Bengal, India, both reportedly among healthcare workers. Authorities acted swiftly, tracing and testing nearly 200 contacts, all of whom tested negative. The Indian Health Ministry assures that the situation is under constant monitoring, with all necessary public health measures in place. No cases have been reported outside India so far, but the vigilance remains high. The rapid response and transparent communication are key to preventing further spread and maintaining public trust during such health crises. In response to the outbreak, several Asian countries have ramped up their precautionary measures. Thailand has started screening passengers at 3 major airports, focusing on flights from West Bengal. Passengers are required to make health declarations, and wildlife departments are increasing screenings at natural tourist attractions. Nepal is also screening arrivals at Kathmandu Airport and land borders with India. Meanwhile, Taiwan is considering classifying Nipah as a high-risk disease, which would trigger immediate reporting and special control measures. These steps show the region's commitment to containing the threat. The Nipah virus's high fatality rate and lack of treatment options make vigilance absolutely essential. Early detection, rapid response, and transparent communication are the best tools for preventing a wider outbreak. The interconnected nature of travel and trade in Asia means that diseases can cross borders quickly, so regional cooperation is vital. By learning from past outbreaks and acting decisively, countries can protect their populations and prevent the virus from becoming a larger epidemic. Public awareness and adherence to health guidelines are also crucial in this collective effort. As the situation continues to evolve, health authorities across Asia remain on high alert. The lessons learned from previous outbreaks are guiding current strategies, emphasizing the importance of early action and international cooperation. While there is no approved vaccine or treatment for Nipah virus yet, ongoing research and preparedness efforts offer hope for the future. For now, public health measures, timely information, and community engagement are the strongest defenses. Staying informed and following official guidance will help everyone navigate this challenging time together.